This Good to Go segment on My West Michigan is sponsored by Spectrum Health Medical Group. Everyone knows medical questions and concerns can arise at any time of the day or night. So now at Spectrum Health, a program called MedNow lets you see a Michigan doctor anytime, anywhere online. Here's Chief Medical Officer Dr. Doug Apple.
As technology's advanced, as we've gotten used to things like Skype or FaceTime, there's ways in which you can also schedule online for certain personal appointments. We have found that there's a need for patients who still need health care, but maybe not at the level that they need it in the past. So how does the healthcare system like Spectrum offer this differently? And that's where we think that this is a good solution for us going forward that allows the community to have services they still need.
Yeah. Okay, so let's break these down one at a time. MedNow. Tell me about the MedNow program.
MedNow is a range of services that actually are now in effect and offer services that include being able to deliver low acuity services to patients on their time, their location, and be able to still do it in 24-hour fashion.
And how does it work?
So there's a couple ways in which you can access it first and foremost. One of which is you can actually call our Spectrum line, and then there's also a way through our MyHealth app or our spectrumhealth.org website where you can either go through the MyHealth portal or you can register for an account, and that'll allow you to be able to click and get into scheduling a service. So in either way, you're able to reach out to Spectrum to say, I need this service and how do I schedule an appointment?
And still connect to a physician who's giving you real answers to what kinds of questions? What would people use that for?
So for instance, you think about whether it's 2 p.m. or 2 a.m. and you don't feel well, you're starting to have a fever, maybe a cough or cold, flu season is coming, but yet you're at work or you're at home in the middle of the night and you can't just run out and get easy access. This is a way in which we can actually come to you by using the technology through your phone or through your laptop computer, something that's a mobile device as long as it's connected through a Wi-Fi so we can ensure it's secure, and it also allows us to have that still personal connection.
Okay, so e-visits and video visits.
So e-visits are where we use the secure messaging. We want to make sure that we're protecting the information that is being exchanged in two different locations. Video visits, for instance, let's say if you develop a rash. For whatever reason, you were out doing yard work this past summer and you develop a rash and you're not sure what it is. This is actually much better and enhanced through the technology and the cameras of phones, where physicians are able to look at that, be able to diagnose it, and if needed, prescribe treatment.
And there is also something called Specialty MedNow. What is that?
Specialty MedNow actually exists in really two different forms. One of which is how does it relate directly to the patients that aren't in the system. We're also using this technology between hospitals. So for instance, if you're at another hospital, you need a specialty consult, we're using this technology to connect to the specialist that we have in Grand Rapids. If it is something that is of need, for instance, we're using this in our oncology care. Lung cancer clinic at Spectrum Health is now using this technology to be able to take care of patients who might be, for instance, in Greenville or Reed City, but yet they don't have to travel all the way to Grand Rapids to see those specialists to follow up on their care.
So I see this as a convenience on both sides, patient and caregiver. Also, it might lessen the wait in the office for people who really do make office visits, but talk about the payment for all of this cost.
So right now with the payment, one of the things that we have found is we can actually lower the cost of care by delivering this service that is actually much more convenient and still given the high quality. So the secure messaging or our e-visits are actually $25 copay, which is no more than what you pay today for those office visits. The video visits are $45. And also if you're a Priority Health member, actually as long as your deductible is met, then that fee is waived. But this is a service that we're not just offering to Priority Health members or Spectrum Health. This is actually what we're offering to all customers or consumers of the state of Michigan.
Learn more about MedNow on our website at The Exchange. See you tomorrow.